Good morning, students. This is a lecture for nursing students on reproductive health. Today, we are going to see the new chapter, that is the second chapter, which says early marriage and early marriage, teenage pregnancy, unwanted pregnancy, abortion, and emergency RH services. So the subtopics under these are child or early marriage, teenage pregnancy, unwanted pregnancy, abortion, whether it is safe or unsafe, emergency reproductive health services like post-abortal cares, emergency contraceptives. Therefore, have attention on this. What are the components that we are going to include under this? Later, at the end of the topics, I will ask you these topics. Don't forget, have special attentions. Good. So the components under this are one, child. What is child? We are going to define what is adolescent, adolescent versus youth, and who is adult, what is early marriage, types of early marriage, cause of early marriage, consequence of early marriage, strategies to compete or stop early marriage. Good. At the end, you should answer these all questions. Good. Who is child? Adolescent, youth, or adults? According to WHO definition, child means it is from birth to 18 years. From birth to 18 years. So we can classify child into 5 stages. The first one is infancy stage. Infancy stage, when we say child less than 1 year or from birth to 1 year, is infancy stage. Even the infancy stage can be classified into subdivision like perinatal, neonate, and post-neonate. Perinatal, when we say, it is from birth to 7 days. Neonatal, from birth to 18 days, and the post-neonatal, 29 days to 1 year or 12 months. So this is infancy stage. The other is toddler stages, 1 to 3 years, preschool, 3 to 6 years, school age child, 6 to 12 years, and adolescent, 10 to 18 years. So we are going to classify into 5. Don't forget again, child can be classified into 1. Infancy, 2nd. Toddler, 3rd. Preschool age, 4th. School age child, the 5th one is an adolescent. An adolescent can be classified into 3 again. Early adolescent, 10 to 13 years. Middle adolescent, 14 to 16 years. Late adolescent, 17 to 18 years. In some country, maybe it varies, sometimes above up to 20, sometimes below. The other is youth. Youth is within age of 15 to 24 years. 15 to 24 years, maybe it depends. In some countries up to 29, in some country up to 25. But according to WHO definition, youth is from 15 to 24 years. The other is adult. Adult is above 24 years. So these are some age determinations. So we are going to focus on adolescent and the youth. Why? Why we focus on adolescent and the youth? Because of 1, lack of message. 2, targeted adolescent and the youth, and they require more information. They will not get enough information. That's why we are going to focus on adolescent and the youth, so they will put themselves under risk. The second one is lack of youth-friendly service, like little access to sexual and reproductive health service, treatment or prevention of STI, including HIV infection. The other is provider, parent, teacher, and the community attitude about youth and sexuality. That false belief that young people are not sexually active, and giving that information will increase sexual activity, which is very false. So we should give them enough information so that they will keep themselves. Sexual experience is not always voluntarily. Usually it begins during adolescence. Conflict between cultural and parental expectation and adolescent emerging values causes serious challenges for young people. So that's why we focus on young and adolescent. The other is lack of providers trained to deal with youth. There are no trained providers, especially in developing countries. They have different needs because of their physical, emotional, social, and psychological development stages or more. They have different cognitive abilities and skills, which require different counseling approaches and more time or less. Interventions can help young people make good decisions and take responsibility for their actions to prevent serious negative consequences in the future. Why early marriage is a global concern? Early marriage is a global concern. Why we say it is a global concern? Today, child marriage remains widely ignored, violation of healthy and the right of girls and the young women in developing country, in developing world. Millions of child brides, some only just past puberty, are denied access to healthy education and economic opportunities. The majority of them are burdened with the roles and responsibilities of wives and mothers without adequate support, resource, or capabilities. Official tolerance of cultural, societal, and customary norms that shape and govern the institution of marriage and family life. Child marriage is culturally packaged as a social necessity, but in many cases, this amounts to socially licensed sexual abuse and exploitation or misuse of child, which is very serious. Child marriage is a risk factor for HIV infection and non-infectious reproductive health problems. What is child or early marriage? How can you define? Simply child or early marriage when we say it is any marriage carried out below the age of 18 years. Any marriage before the spouse is physically, physiologically, and psychologically ready to shoulder the responsibility of marriage and childbearing, as also called early marriage. It involves either one or both spouse being children and may take place with or without formal registration and under civil, religious, or customary or usual laws. So this is early marriage. Don't forget any marriage below 18 years, 8 years. What are types of early marriage? We are going to classify it easily into four types. The first one is promissory marriage. Promise. This means arranged before birth of the child, before the child is born, whether the child is become female or male, no one knows. Simply they agreed, the two parents agreed that if I got daughter, if I got son, I will give you. This is what we call it promissory marriage, promise. The second one is child marriage. Child marriage means arranged for girls under 10 years of age, and the bride is placed under the custody or guardianship of her parents-in-law until she reaches puberty age. She is under control of parents-in-law until she is become puberty. The third one is early adolescent marriage. Early adolescent marriage means a marriage arranged between the age of 10 to 14 years, and the married child may stay with parents but periodically visit her parents-in-law. The last one or the fourth one is late adolescent marriage. Late adolescent marriage means arranged for bride between the age of 15 to 18 years of old. So simply we can classify early marriage into four as promise or promissory marriage, child marriage, early adolescent marriage, and the late adolescent marriage. Don't forget this one. What is the reason for practicing early marriage? What is the cause? What are the factors that promote or reinforce child marriage? Generally, early marriage is more common among poor, rural, uneducated, female sex, conflict or disaster affected populations. So, what do you think the factors that exacerbate or increase early marriage? There are a number of factors. These factors in general we can classify into three. The first one is material benefits. Second one is economic reason. The third one is social reason. The first one, let's see material benefits. Sorry, what's material benefits? Ceremony contribution in kind or in cash from relatives. During the wedding ceremony, the relatives may bring something for the parents. So they need these material benefits. Urge of dowry or gift or number of animals in a form of bride price, which is as a payback. Look, for the female parents, so number of animals, like for example, you can say camel, maybe 5 camel or 10 camel, maybe given to the female parents as a payback. The other is early marriage promoted and reinforced because of fear of losing a bride price, because of abduction by a family who is physically better off. Maybe she's going to be abducted, or she's maybe going to be related with a parent who is financially better off, who cannot give 5 or 10 camels. Due to this, because the parent needs this material benefits, they are going to give their children for the marriages. The second one is economic reason. First one, don't forget, we have said the first one is material benefits. The second one, economic reason. Economic reason, when we say early marriage promoted and reinforced because of fear of parents, obligation to secure child's future before they got weak or die. Maybe they wanted to secure their child's future. The second one is future reciprocal assistance. Maybe they need assistance from their children. Reduction of financial dependency of children. If this child live with them, maybe they need more financial. That's why to reduce, they are going to they are going to give or let her for marriage. The other is linkage to family who is financially better off or a better social standing. They need to link themselves with a family with a better or socialist good social standing. The third one is social reasons. Early marriage promote and reinforced because of social reason. This is one, fear for abduction or kidnap. Maybe she's kidnapped, or cap or fear of relative with unwanted family. Maybe the daughters or the girls may have a relation with a boy, and the parents of her or her parent will not do not want to have a relation with these parents. Prestige or social acceptance. Fear of the female children not doing well in school. They may fear this one. Fear of stigmatization by society, protecting virginity, or premarital sex or unwanted pregnancy. Urge to conform to tradition, cementing or linking or relation ties to a family who is a better social standing. These are the major reasons. What are these reasons? Don't forget. One, material benefits. Second, economic reason. Third one is social reason. It is due to this they are practicing early marriage. When we see the magnitude of early marriage, it is very difficult to get accurate data or the true extent of child marriage. It was estimated in 2004 that within the next decade, more than 100 million girls in the developing world would be married before age of 18 years. The UNICEF statistical study on child marriage confirms that the practice is most common in South Asia, where over 48% were married before they reached 18 years. In Africa, about 42%. In Latin America and the Caribbean, in about 29%. In Middle East, common in Yemen like in Palestine, that half of under 18 years or 50% were already married. So these are some magnitudes. What is the consequence of early marriage? What the complications that maybe occur due to early marriage? The first one is increased health costs. Maybe like fistula may occur. Fistula, it is injury to a human urinary bladder and rectum that leaves here leaking urine and or feces via birth canal. So this is what fistula may occur because of her reproductive organ is not well developed. The other is young women under 18 years are especially prone to developing fistulas if they cannot get a cesarean section during prolonged obstructed labor. So these are some of the reasons. Pregnancy-related deaths are also leading cause of mortality in 15 to 18 years old girls, and those aged under 15 years are 5 times more likely to die than those aged over 18 years. Infant deaths are also twice as high in babies of very young mothers. So the first one is increased healthy costs. The second one is increased vulnerability to HIV. Recent research conducted by Population Council shows that child wives are more vulnerable to contracting HIV. Marriage often increases sexual activity and the likelihood of exposure and the risk to contracting HIV. So contributory factors include young age at marriage, the wide spousal age gap. Sometimes you know that the more than 15 or 60 years old guys can marry 15 years or 12 years female. This is high or wide spousal age gap. The other frequency of unprotected sexual activity, limited access to information and negotiation powers. Many young bride cannot negotiate safe sex even when they have knowledge about how to protect themselves and are under pressure to demonstrate their fertility. So this is one special consequence. The third one is decreased education and developing opportunity costs. The current international developing targets the middle developing goals, particularly those on poverty, universal primary education, maternal and child mortality, and HIV/AIDS, have not been met in many countries in Africa. Child marriage directly hampers effort to achieve the middle millennium development goal. The fourth one is increased risk of poverty. Child marriage makes it harder for families, communities, and countries to escape poverty. It erodes the healthy and the well-being of girls and the overall welfare of communities. It also undercuts international effort to fight poverty and HIV. So these are some consequences. What is the strategy to combat or stop early marriage? First one is educate girls and the boys about consequences of early marriage. Inform them clearly what is the consequences, what will be the complications. Educate not only female, males again. Second, educate community, especially parents on the consequences of early marriage. Because most of the girls are under pressure of their parents. If the parents now or have information about early marriages, maybe we can stop or decrease early marriage. The other law by government to make primary education mandatory. If the government is going to punish those girls who didn't want to school, maybe it will be stopped again. Police, prosecutor, and the courts need to be equipped to deal with the problems. So build a school closer to the community, involve more female teachers as role models, so that if one female is become a teacher, the others they will follow her. That's why maybe it will be good. Initiate grassroots level work, introduction to birth and marriage, registration again. Therefore, this is one special consequences of uh, early marriage. This is all about today's lectures. Next time we will meet each other with teenage pregnancy. Till that, see you everybody. If you have question, just contact me through the WhatsApp. See you. Bye bye.